Hi there, Callum Robertson from Jacobs here. I've been working with Stephen and his team developing the low emissions zone strategy. It's a question for Colin. Something that we become clear to us through the whole process is that selling the benefits of reducing vehicle emissions is going to be absolutely key. Being an engineer, I like to have certainties. A lot of what you've said in your presentation is that there's a lot of uncertainties about the effects on health. How can we improve the certainty levels? What work needs to be done and who needs to be engaged to develop that?
Interesting question. I think the stock answer from academics would be let's do more research. And I think more and more research is being done. I think there are different angles to the research in terms of trying to define what the kind of pathology behind the effects is. As I've tried to explain, I think there's a general consensus that air pollution does have negative impacts on health. That's not really disputed. And I think we need to just focus on that kind of general consensus of opinion that the effects are undisputed. If we start trying to delve too much into the mechanisms of how precisely that happens, there are lots of PhDs and careers will be built on that. But I don't think that's necessarily terribly helpful for us in terms of how to influence public opinion, in terms of getting people to realise they contribute to it and they have a role in trying to improve the situation. So I'm probably not answering your question really. I don't think you can necessarily improve the certainty levels. What you can do is focus on the areas where you are more certain, and that's what I'm trying to emphasise.
One for Colin. It's Jack Pease from Air Quality Bulletin. Whereas I feel I've stepped forward 10 years in terms of policy coming here, listening to your talk, I feel I've stepped back 10 years to when I used to hear all the medics sort of arguing that there weren't air pollution effects. You seem to have downplayed the impacts and emphasised the uncertainty, whereas if I go to conferences, as I do all the time down south, it's not a question of that there are impacts, and a lot of them, it's simply how and how big. Why are you downplaying the impacts so much?
I wouldn't say I am downplaying it at all. I'm trying to emphasise that I think we have to be honest with the public and not mislead them by trying to say we know far more than we actually do in terms of the mechanics of it. I'm saying what we can be certain about, based on the consensus, is that there are definitely adverse impacts. But I don't think there's anything to be gained by using statistics inappropriately and basically trying to give misleading information to the public. I think we have to be honest with them about the state of knowledge, but at the same time try to find ways to persuade them in a more positive sense that adopting travel, active travel, is better for them generally.
It's Paula Charlson here from SEPA. I thought Colin's presentation was fantastic, actually. It was really clear. The message that's there is that it exacerbates existing conditions. I wonder if that therefore influences where we target action in terms of addressing air quality. Is it linked to inequalities and a health inequalities agenda?
I think the answer is yes. I think within the public health fraternity, it's regarded as an inequalities issue among the many. But it's another reason why the focus should be on trying to reduce inequalities, and air pollution is just another example of inequalities that affect the deprived, the poorer people, those who have impaired health already.